I'm going to continue with the chapter H. Elite health professionals. Community health. The health of the community depends on a large number of people other than medical practitioners and nurses. This can be grouped under the heading of early health professionals. They include the following: physiotherapists, physios, help people to move by guiding them to do exercise or by treating their body with the meshes. Treatment by manipulating muscle and joint with the hand. Occupational therapists help people with disability, disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally. For example, blindness or deafness. Social work help people to solve their social problems, for example, poor housing or unemployment or family problem. Chiropodist, also known as pediatrist, treat condition affects the feet. Technicians. There are numerous technicians, people who work with scientific equipment, such as radiographer, who are known as X-ray technicians, ambulance technicians work in the emergency medicine service, and ambulance technicians with more advanced qualification is called a paramedic, protest, prothetist, and orthotist. Prosthetists and orthotists provide care for anyone who needs artificial limbs and prosthesis or a device to support or control part of the body, and orthosis. They also advise or rehabilitation, helping patients return to normal life and work after treatment. Prosthetists provide artificial replacement for patients who have had an amputation or were born without a limb. Orthotists provide a range of plates and other devices to aid movement, correct deformity from abnormal development of part of the body, for example, clubfoot and relief pain. Opticians. Opticians test ages and prescribe glasses, also known as spectacles and contract lens when necessary. The examination includes measuring intraocular pressure, the pressure of fluid inside the eye, and, examining the retina if the optician suspects an eye disease such as glaucoma. They refer patients to their GP for treatment. The GP may then refer the patients or to an ophthalmologist, a doctor who specializes in diseases of the eye. make word combination using word from H boss look to help you. Ambulance with technical, artificial with limb, club with foot, contract with lens, contact with lens, health with professional, occupational with therapist, social with worker, which which all it health professional code best help the following people. Look at A, B, and C and D. Opposite to health. A young unmarried woman who has just had a baby, social worker. A woman who is having difficulty using her right arm following a fracture, physiotherapist. Someone who needs glasses, opticians. An elderly woman who has had a below knee amputation, prosthesis, or occupational therapist. A man who why has Alzheimer disease is social work. A man with fungal infections of his feet, chiropractic or podiatrist. Complete the test. Look at A and C opposite to help you. A prosthesis work with patients of all ages as member of clinical team based at a large hospital. The patient may need prosthesis as a result of accident or amputation, following disease such as diabetes. Alternatively, they may have been born with how the orthotists work alongside doctor, nurse, physiotherapist, and occupational therapist to give the people under their care the best possible rehabilitation. Their main aim is the enable the patient to lead a normal life at work and leisure. An orthotist often work in a clinic as part of an outpatient service, and all visit other centers provide a service for people with special needs. They deal with people of all age, for instance, children who have cerebral palsy may require splints to help them walk, and many older people need special shoes to correct deformity or deformities. If damaged and part of the human skeleton might require same for orthotics, the orthotics may be needed to reposition the body or relieve pain. Hospital. Introduction to a hospital. Jordi Pong is a fourth-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barron is introducing him to the hospital. Dr. Barron said, "The Royal Infirmary is the name of the university hospital for Edinburgh University. It's general hospital, dealing with all types of patients and illness except pediatrics. We have a specialty hospital for that. Another part of Edinburgh, the hospital for sick children. You can see some of the department in our hospital on the scene. Of course, there are many other, for example, the intensive care unit, A S no ACO, right? And the surgical high dependency unit, Georgie. What does outpatient mean, Dr. Barrow? Outpatient are the people who come hospital to attend a clinic or have test or treatment, and they return have on the same day. Inpatients stay in the hospital for 1 or more days. The room where they stay are called ward if a patient treatment require only 1 day, such as a samples operation. They can be admitted to the day surgery unit. Welcome to the Royal Family South Entrance Car Park C uh, and the visitor of staff. The Simpson Center for Reproductive Health, Gynecology Emergency, Maternity Emergency, Neonatology Emergency, Operation Department, all wards, the surgery unit and endoscopy, X-ray department, combined assessment. Outpatient, Dr. Baron, the accident and emergency department, A&E, also called casualty. It's where patients who are acquired ill with sudden serious condition come from assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinical in one of the outpatient department. OPD is they have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explain the patient problem. Inpatient, inpatient. Dr. Barrow. The inpatient in a hospital are admitted in of three main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for treatment they need, as in the case of hip replacement, they are put on waiting list for admission. Alternatively, their GP may arrange the admission by telephone because are actually, if for example we suspect myocardial infarction, or they are seen in the A and E department where the doctor on duty working at the time arranges the admission. This will happen in the case of patient with fractured neck or femur, for example. Their hospital may have a assessment unit where patient can be admitted temporarily while their condition is assessed. Jordi assessed. Dr. Baron. Yes, decisions are made about their condition and what need to be to help them after treatment is complete. The patient is discharged back to GP is care. Complete the table with word from A, B, and C opposite. Put a street mark in front of the street syllable in each word. The first one has been done for you. Verb, noun, admit, admission, assessment, discharge, discharge, operate, operation, refer, referral, treatment, treatment, treatment. Make word combination using word from each box. Look at C opposite to help you. Actually ill. Assessment unit. One duty. Duty. Referral letter. Waiting list. Which hospital department will be most operated for the following patient? Look at A, B, and C opposite to help you. A woman in diabetic home intensive care unit. A patient who has just had a radical prostat- prostatectomy. High dependence unit HDU. A patient who is to have skin lesion removed. The surgery unit. A man with a foreign body in his age. Gynecology emergencies. A woman with treatment abortion. Accident emergency. A and complete the extract from the information left left for patient. Look 8, B and C. Information for outpatient. When you arrive at the clinic or hospital, please tell the receptionist who will welcome you check your details and direct to the waiting area. The length of your visit will depend on the treatment you are going to have. You may need to have some tests, such as X-ray, which could mean going to another department, or you may be referred to other professionals, such as physiotherapists or dietitians. You may need to revisit the clinic if staff at the clinic want to see you again. Another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as in a patient or for day surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GPS care. Primary care. The National Health Service. The National Health Service (NHS) is responsible for health care for everyone in the UK. Although a small number choose to pay for private care, treatment is free, but there is a prescription charge for drugs and appliances such as cervical coral wizards. exceptions for some patients, such as children and the elderly. Primary care is provided general practitioner, something known as family doctor, nurse, dentist, pharmacist, and opticians. GPS work in patients of 1 to 20 practice are based in surgery and look after the health of from 1,000 50,000 people in their local community. They also provide health education in areas such as smoking and that run clinics give vaccinations. For example, for influenza, and may perform minor surgeries such as removal of warts and moles. If a patient needs special care, the GP will make a refer the patient to consultant in secondary care. Patients are normally mm, care. Patients are normally seen or on an appointment basis. Home visits are made when patients are housebound, unable to leave their homes or too ill to attend surgery. Out of hours, OOH treatment for 6 p.m. to 8 a.m. is provided by the local primary care through which organizes shift of GPS and local GPS to cover if someone is absent. The practice team. A typical GP practice employee receptionists. They are responsible for initial patient contact, making appointment taking, re- request for repeat prescription, taking medicines from patient and other health care providers and for filling a scanning document into the patient record. The practice manager has responsible for finance of something and something for AT supervise reception staff here locums and help prepare the practice development plan. Practice nurse from ACE main diabetes and cardiovascular disease clinics as well as one-to-one clinics for those who wish to give up smoking. In addition to practice staff, GPS work with a number of health professionals. District nurse visit temporarily housebound patients such as recently discharged of hospital patients to change dressings such as ulcer dressings. Health visitor visiting families to carry out checkups on young children, particularly under 5, to make sure their health and special attention is paid to families in need, such as those who live in poverty. They also to do baby immunization. Um, Meet with run clinic for antenatal patients. Physiotherapists provide hands-on treatment, both uh, all-stage patient exercise they can do to improve their conditions after an accident operation. AGPS Day. Doctors who are working practice in a small market town with three other family doctor. Their surgery is in the center of the town and is shared by three practices. This is a typical working morning when she is not the duty doctor responsible for emergencies and urgent problems. Complete the sentence. Look at A opposite to help you. Children over 6 people with some chronic disease do not have to pay prescription charge in the UK. Patients with mobility problem may be unable to go out. They are housebound. The average GP appointment 10 minutes long. A locum is someone who takes the place of staff member who is on leave. Care outside working hours is now as out of hours treatment. Make the word combination using a word or phrase for each both on the word can be used twice. Look at A and B opposite to help you. Charge dressing, make appointments, make home visits, perform minor surgeries, refer a patient, run a clinic, supervise staff, take mes- message. Which number of a practice team will be responsible for each two following? Look at B opposite to help you. Running a clinic for pregnant woman midwife. Teaching a patient who to stretch his broken leg physiotherapist. Letting, let, letting the GP know that a patient can't come come to her appointment receptionist. Running a clinic for people who want to lose weight. Practice nurse. Visit a patient who has just returned home after hernia operation. District nurse carry out checkups on children in poor neighborhoods. Health visitor organism cover for an absent doctor. Practice manager complete the diary for the Thursday afternoon. Look at A and C opposite to happy. Um, the one is surgery, two appointment, three reception, four visit, five prescription, six referrals, seven OOH. Medical education in the UK. Medical education in the UK covers undergrad education for or 5 years at medical school section of university responsible for medical education. A 2-year foundation program which provides training for a new doctor after graduation through a series of placements in different specialties. Postgraduate training which doctors take become GPS or consultant senior specialists often deliver through college for different specialties. For example, the Royal College of Physicians continuing professional development in the form of course and seminar which doctors undertake through their working live to keep to date. Keep up to date. Struck from underground prospectus. The MBHB, Bachelor of Medicine Bachelor of Cellular of Surgery, is 5 years and greater medical degree course. Most of your learning takes place in small groups. The main components are core years 1 3, an integrated program of clinical and science topics mainly present through problem-based learning (PBL), where you work with others on series of case problems. Student select module Student select module SSMS allow you to choose from menu of subjects such as sport, medicine, or even study language as preparation for overseas elective hospital attachment of your own choice between years 4 and 5. Vocational studies and clinical skills. The component prepares you for the clinical skill required for contact with the patient from year one of your course through periods practical training where you are attachment to hospital department of general practice. Clinical attachment years and 5 a series of week clinical attachment in medicine, surgery, physiologist, medicine, shield, health obstetrics and gynecology and general practice. A student view Ellen, a medical student, described her course. I'm just finished my first years of medicine. What I like about this course is that you are involved with the patient from the very beginning. Even our first year, we spend time in the hospital. Much of the course is PBL. We have 2 hour section week where we work in group for aid to them solving clinical problem. We decide together how to tackle the problem, look up books and only source, make notes and discuss the case together. Is a great way of learning and getting to know the other student in the past medical student how lecturers with the world class taking notes for lectures from 9 to 5, but now it's mainly group work. Through we have some lectures and seminars where work in a small group with a tutor. I like all, all of it. Even this section we get to put up cadavers from the second month of the course. Match the activities to stage of medical education in the UK give opposite. This is dissecting cadavers undergrad, keeping a log of surgical procedure observed and performed postgraded, working for 4 months in excelling an emergency to experience this specialty, taking a 4-week attachment in obstetrics and gynecology undergrad, mm, taking an online course recent development in cardiovascular disease, continue professional development, complete the sentence, look at B and C opposite to help you. Just before their final year, students have the chance to take an elective in a hospital of their choose anywhere in the world. Problem-based learning contract with approach where each subject is taught separately. These days, lectures are often interactive with regular opportunity for students to ask questions. In a clinical attachment, students learn how to treat and manage patients. Student-tailored module can be topics from outside medicine such as foreign language, dissection of cadaver seems important part of the anatomy component. The medical school at the University of Edinburgh is one of the oldest in the UK. She consulted at the Royal on the leading pediatric heart specialist in the country. The Royal College of Surgeons in the Edinburgh date from 1505. We have a seminar each week where we discuss on topic in a small group with our lectures.